Tips for dealing with extreme morning sickness. Now, I'm sitting here with Dr Ellie Bailey. She's a gynaecologist and an obstetrician from Sydney Adventist Hospital. Thanks for being here, Dr Ellie.
Hello, thanks for having me.
Yeah, so look, extreme morning sickness, it's one thing just to be pregnant and have your, nausea and headaches and things like that. But some of us experience some severe morning sickness.
Yep, you're spot on.
Sometimes afternoon sickness or day sickness.
All day, all night. Yes.
Yeah, so what's going on here?
So that's the same condition that Princess Catherine had through all three of her pregnancies, if you remember.
Catherine Middleton.
Yes,
yeah.
Princess Catherine.
Yeah.
It's basically an extreme form of morning sickness. So most women will get some nausea and vomiting in their pregnancy, especially in the first trimester.
Right.
But some people have debilitating nausea and vomiting. And that affects maybe about 1% of pregnant women.
Right.
And we call that hyperemesis gravidarum.
Okay.
And that is where the nausea and vomiting impacts on their life. They can't go to work, they can't leave the house. And that's a really severe and quite debilitating condition, which is, wouldn't wish on your worst enemy.
Is it, are some people more prone to this severe morning sickness, or is it it's
almost certainly just bad luck, and it can run in families. Some siblings, sisters can both get it, but just because you've even had it for one pregnancy doesn't mean you'll necessarily get it again in your next pregnancy.
That's a good thing. That's promising.
So some women say, I'm not having any more children because it was so bad.
Yeah.
And actually you can often reassure them that it's not always going to be the same experience next time around.
So what are some tips, I guess, as mums, we want to know how we can manage when we see that, we're not doing too good with this morning sickness?
When I see women in clinics at sort of 8 and 10 weeks, they've often been suffering for weeks, over a month already, because they haven't gone to the doctor and done anything about it.
Because people are...
because you presume it's normal,
yeah.
but you don't have to suffer, and there's absolutely no benefit from being a martyr. So I always say the simple things people can do from home is small, regular meals rather than, massive meals that are going to sit on heavy on your stomach.
Right.
Lots of women find the salty crackers and things are good, and I reassure them that the baby's not going to starve. The baby will develop just fine, even if you're living just on salty crackers for the first few months.
Yeah.
Staying hydrated, so lots of fluid, and lots of people eat icy poles and things just to keep themselves hydrated. But then you have to get onto the medications. If those simple tricks aren't working, you need to get onto medications. The first line most people use is a vitamin called B6. It's also called pyridoxine, and you can buy it over the counter from the chemist.
Right.
And that's a really good medication at just taking the edge off things.
It doesn't harm the baby in any way.
Doesn't harm the baby. It's only a vitamin. It's very safe, and you don't need to go to the GP to get a prescription for that. You can buy it yourself.
Right.
And then if that's not working, then you start getting into the prescription medications, which either your GP or your obstetrician can prescribe for you. And there's honestly dozens of them. And so if one doesn't work, you can try another. And for the majority of people, you can get on top of their symptoms with the anti-nausea medications, which are very safe in pregnancy. We wouldn't give them if they weren't.
Love it. Thank you so much, Dr Ellie. I know that's helped you. Don't go it alone. Don't be a martyr, as Dr Ellie has said.
Yep.
There's help out there. So keep it locked right here at Mums at the Table.